us into the new hour. And in the studio with us now, Dr. Jennifer Bryan. She is the chair, right, of the Board of Trustees of the Mississippi Medical Association. Good morning, Dr. Bryan. Thanks so much for joining us.
Good morning. Thanks for having me.
You bet. So first, it is Doctor's Day. And I don't know if a lot of folks are familiar with Doctor's Day, but this is the day we celebrate it. I noticed on the way in, the Mississippi Medical Association has a digital billboard right out here.
I saw one, too, on the way down to Lakeland. I texted Dr. Brunson and thanked him for that. Certainly, we wanted the doctors to know that we value them.
Sure.
You know, it's the day in and day out of the pandemic and their jobs, and what they do is important. And the Medical Association just wanted to recognize our membership and our physicians and say thank you.
Sure. And well, we should. And we are, as a society, and certainly here in Mississippi, I think very blessed to have a fantastic medical community. And I think that often gets overlooked. And it's also true that we have, unfortunately, as measured, an unhealthy population, unfortunately, in our state. But we have great medical care. I hear from lots of my doctor friends, if we could just get the patients to accept the counseling, the medical counseling, and really take it seriously, we could prevent lots of disease, lots of deleterious results, and even costs.
Oh, I think you make a great point. The medical community is excellent. If you want to learn about disease processes, Mississippi is a great place to train. Our population is historically quite unhealthy, and we've got barriers on counseling and so on. Culturally, our diet is not the best, and we are more sedentary. A lot of us are busy with life activities and such, and we understand that, but we continue to counsel on the things that keep us healthy. You're right, though. There's so much that just general active lifestyle and healthy diet, it's amazing the things that weight loss and being healthy would fix.
Just taking medicine. I've had doctor friends, and I bet you will agree, and you're familiar with this situation, Dr. Bryan, that have said that they prescribe medicine to patients who simply won't take it, but then ask the question, but if I don't, you're still going to take care of me, though, right?
Absolutely.
Is that true?
You do, and then pull out a list of 10 over-the-counter supplements that they're taking in lieu of, which not knocking necessarily on supplements, but you get the gist. It's difficult at times. And it also, I had this thought this morning. We're into our vaccine-hesitant crowd with COVID.
Right.
And so on Doctor's Day, I mean, a shout-out to these doctors and other members of the physician-led team, which you guys know I'm passionate about. But, that's what we're doing behind every exam room door right now, is convincing folks that, hey, the vaccine's a good idea. And that wears on our healthcare workforce. I mean, these conversations over and over again, and we're doing them because we believe in it. It's the right thing to do. We want to teach people and meet them where they are. But that is wearing on our workforce, just the emotional strain of the education that goes behind that, if that makes sense.
I'm hearing from physician friends that I have that are at high levels, high ranking, that not just practicing medicine professionally, but also managing large teams of medical professionals. And they've shared with me exactly what you're saying, that they're engaging in presentations and communication and education about the vaccines in an effort to encourage their workers to get on board, still being met with some degree of hesitancy. However, I'm not sure I even know a physician anymore that has not been vaccinated.
Oh no. We joked about racing to the front of the line when it first started. I mean, we were doing that for leadership to show that we practiced what we preached and that this was safe. But certainly we did not get any pushback. But that's how we train, right? Looking at the science and piecing it apart and knowing what's safe. And so if you don't do that, it's human nature to question. It's human nature to wonder, right?
Sure.
But that's what you have your doctors for, to get that advice and to go through the information with you.
Well, I know that is quite the challenge. And so I think what often gets overlooked is that gets layered on everything else they're doing in the meantime. So it's not only that the pandemic is a health problem, but that it's additive. I mean, it's additional. It didn't exist a year ago, and now we've just dumped this whole new sort of health issue on the medical community.
You're right, and during the break, you were bringing up our healthcare workforce, and the holes that have been punched in that through the pandemic have been very trying. So, we talked a lot about physician burnout, healthcare worker burnout, even before the pandemic happened. So there was a lot of strain, and then the pandemic hits, and then you've got folks that actually catch COVID, right?
Yeah.
And they're sick, and their families are on quarantine. And so we're working on kind of this, not necessarily skeleton crew, but we're stressed, right, across the system, clinics, hospitals, and now we've got the vaccine distribution, which is going wonderfully.
Yeah.
These guys are really doing a fantastic job. And then we got the low-hanging fruit. We got the people who were just racing to get a vaccine, and now we've entered the hesitant population largely. And it's difficult at times, but most people are reasonable when you sit down and talk with them.
Sure.
They'll come around and understand the value.
Yeah, and they're certainly not insinuating that people should be forced. I certainly don't support that. I don't
Right.
support government force of that. But it does make sense to endeavor to educate.
No doubt.
And communicate and try to assuage those fears with science and with people you trust.
Yeah, it's always the patient's decision.
Sure.
But certainly as a physician, we are in the business of telling folks the accurate information and then helping them to come to their own decision about it. And the vaccines are way off of this hamster wheel. I think we're seeing that in the numbers too.
Yeah, and it appears from reports I'm reading from national media that the hesitancy is starting to wane. I think one thing is we're seeing more people that have been vaccinated and haven't really experienced anything negative, and so they're paying attention to that,
right.
and they're looking for that. What about down there at the Capitol with respect to legislation that you guys advocated for or tracked? Give us a little update on that.
Absolutely. So we're watching the Medicaid tech bill real closely, and as you know, they're still looking at that. But we're hopeful for some postpartum coverage there with Medicaid. That's a big thing that we're looking at. So last I heard, the report was still out, but we're anxiously awaiting that. The telemedicine did sadly die in conference yesterday. It just seemed that the two sides between the Senate and the House just could not come together there. We're disappointed. I know Dr. Horn spoke about that.
I don't get that.
I don't either. We've got a vision for the future. I'll shout out to Dr. Carrie Wright with the Department of Education and the school clinics. Just been amazing working with her, and we had so many stakeholders at the table. It was sad, really, but I did also want to shout out to Senator Nicole Boyd and Walter Michelle and Dean Kirby. They did a yeoman's work. Couldn't have asked, and Insurance Commissioner Mike Cheney. We just had such wonderful friends, and I don't know, the Senate just kind of stood their ground and said that they did not want anything that would go backwards on the definition of telemedicine and what the patients are receiving now. So we continue to, we know that telemedicine is the future. We know that at some point we will get there, right? It's just how we do it. But sad to report that died in conference. And then, earlier in the session, the scope of practice was a big one, and that one died in committee. And we had an Alzheimer's caregiver support bill we're real excited about that provides, it's a kind of a pilot program support for them. And then the optometry bill that was earlier in the session. So
right.
Winding things down, and it's been a long year for a lot of us. So, but that's kind of an update.
Yeah. Where does the association stand with respect to certificate of need laws?
The certificate of need laws.
Well, the guidelines, the regulations,
Right.
I guess, that are administered by the Department of Health.
Right. So I could speak personally on all that.
Okay.
I don't think we have a stance on it. We've watched that. We've watched areas that really wanted to provide a service not be able to, and then in certain areas we've seen people just be unable to provide services.